10:10. Yes.
2 minutes.
Yeah, 2 minutes. We'll be going live. We're on the steps
Starting soon.
of the Capitol. Yes. We're gonna be getting up here and watch out. Press conference coming.
Birth workers, organizers, legislators, community advocates, birth justice supporters, friends, and folks who came with their families, thank you all for being here today. We gather in momentum for the journey towards reproductive and maternal health care transformation in New York State. I'm Myla Flores, the Executive Director of the Birthing Place and President of the New York State Birth Center Association, and I'm thrilled to welcome you to witness the Mobilize Maternal Health Coalition. This is our day of action where we, as birth workers and advocates, are uplifting particular hopes and wishes and demands that will help us revolutionize what we seek to experience as birth workers and families and community members here in New York. As an advocate for and birth worker of 18 years, I've witnessed the tenacity of many who come before us. And despite the disheartening and angering disparities in maternal health care, the lack of access to quality care, and even decreasing access in some areas, there has been so much resilience and hope and power in community. Mobilize Maternal Health Coalition was born out of a necessity driven by a vision to improve maternal health care, and we have worked tirelessly and on the shoulders of those who've worked before us. And as a diverse network of midwives, doulas, birth workers, legislators, advocates, dedicated to increasing access to midwifery and birth centers in New York State and supportive legislation that improves care for families and the infants and the blossoming community that we seek to have. To address this, we must prioritize transformative change, streamlined licensure regulations, equitable Medicaid reimbursement, increased access to person-centered care, and advancing policy reform and community-driven solutions. We can improve maternal health outcomes. This problem has existed for far too long. We can reduce disparities, and we can empower our communities to thrive. Is that right? Yes. So I'd love to acknowledge the individuals who are here today. And first off, I want to name some folks who have been incredibly supportive. Our representative, Amy Paulus, Julia Salazar, Jessica Rojas Gonzalez, and some of the speakers today, Samantha Bandry, Mariah, and Kim Holden, Charlene O'Benny. We are all going to help uplift this common and particular interests that really uplift and co-elevate the message that we seek to do so. So first off, Tisha Graham, thank you, a CPN here in New York State. Thank you for your tireless advocacy, and here, take the stage.
Hi, good morning, everybody. I'm so happy to be here. I am here representing not only the coalition, very proud to be the organizations of the Mobilize Maternal Health Care Coalition in New York. I am representing New York's certified professional midwives. And when I say New York needs, you say CPMs. New York needs CPMs. New York needs CPMs. CPMs. Certified professional midwives are licensed in 38 other states. Their designation, their credential is recognized by the Federal Department of Education, but New York is slow and lacking in recognizing this very important credential for midwives like myself who are specifically trained to attend families in the out-of-hospital birth setting, community midwives, out-of-hospital birth centers, and we do home births. And when I say New York needs, you say more birth centers. New York needs more birth centers. More birth centers. More birth centers. Our two main sponsors of our CPM licensing bill who are here today, and I very much appreciate your time and support. I want to bring up to the podium Assemblyperson Amy Paulus and Senator Julia Salazar. Good morning, everyone. Good morning. And thank you for joining us. Thank you to the birth workers, midwives, and supporters who have joined us here today. I'm Senator Julia Salazar. I am very proud to support this entire agenda, maternal healthcare justice agenda, but will focus on the midwifery bill, the CPM bill that I sponsor with Assemblymember Amy Paulus. New York State is facing a maternal care crisis. In 20 counties in New York State, no maternal health care services are offered. In an additional 21 counties in New York State, there is only one hospital in the county that provides maternal health care. This crisis disproportionately impacts Black women, and the discrepancies are staggering. The rate of pregnancy-related deaths is 4 times higher among Black New Yorkers than their white peers in New York. Multiple studies show that diverse and highly trained certified nurse midwives and certified midwives contribute to reducing maternal mortality rates and racial disparities. New York currently licenses nurse midwives and midwives, both of which receive extensive education and work in hospital settings. However, New York State does not license CPMs, even though 38 other states do. CPMs offer a level of culturally sensitive care that birthing parents often struggle to find in a hospital birth system. This includes individuals who simply may not want to go to the hospital, they may not be comfortable giving birth in a hospital, or individuals who cannot easily access hospital care due to the lack of availability where they live. During the peak of the COVID-19 pandemic, for 3 years, CPMs were able to practice without penalty in New York because of emergency executive orders that allowed them to do so. But that is not currently the case, and we must pass this bill to change that. This bill does not expand scope of practice. It doesn't create some new profession that does not exist. It fills instead a gap that is created by the current midwifery licensing statute in New York by creating a path to licensure for community-based midwifery, a crucial service that many hospital-trained CNMs and CMs are not currently prepared to provide. CPMs have extensive clinical training. They receive similar education to those at the certificate, undergrad, or graduate level. Evidence shows that when midwives are integrated into healthcare systems, there are significant improvements in outcomes for both the birthing parent and the baby. This includes fewer C-sections, higher breastfeeding rates, and higher levels of overall satisfaction with the birth experience. Licensing CPMs would allow individuals to provide care in their communities to people who may not want to be involved in a hospital system or simply live too far from a hospital. It would help address the high rates of maternal mortality and morbidity that New York State sees, especially among communities of color. It is long overdue that we pass this bill. Thank you all for your support. Let's make this
Thank you so much. Couldn't have a better partner in the Senate. Thank you. I want to just bring us back to the reality of birthing. It's something that's been going on a long time, right? And yet, we've improved almost every other type of medical and health outcome, and we've made this one worse. You know, I was lucky that I found midwives for all three of my pregnancies. Midwives taught all three of my babies, 2 at home. Very proud of her. I can look back, and it's one of the most positive things that I have ever achieved, that I've ever experienced. And that is due completely to my caretakers. They made that experience so positive that I have the fondest memory. And I can tell you, just in the bantering we did prior to setting up or speaking today, that's not true for my colleagues who didn't have midwives. They were not as lucky as I was. Women deserve to have a good birth experience. We know it's possible, but we don't have the instruments. We don't have enough midwives. We don't have enough doulas. We don't have enough birthing centers. What we have instead is a system that has allowed C-sections to go out of control. And people say to me all the time, why is that bad? Why is having a C-section bad? I'll tell you why. That's the one thing that leads to more bad outcomes for the mom. Women that I know have been told do not have a third child when you've had 2 C-sections. Why? Because you are likely to hemorrhage. I had a staff member who had 5 C-sections, was never told that she could hemorrhage and almost died. She's a colleague, just so you know. It's completely outrageous that we haven't licensed everyone that we could and should to make maternal health, maternal morbidity and mortality go down, and to do a better job for the women in New York State. I'm very, very proud to sponsor this bill, and we will find a path forward. Thank you.
We will find a path forward. I love that. today, but I have a message from him, and I wanted to share, have it listed here. First of all, I want to thank him for his unwavering support. If we don't know who Bruce McIntyre is, he is a father, a parent, a victim to maternal health, the crisis here in New York State. This individual lost his partner due to a C-section and a negligent care. And one of the things he simply wanted to extend as he continues to turn his pain into power, he has acknowledged numerous times that had he had access to midwives early in Amber's pregnancy, he believes she would not have died. They sought out birth center care, and knowing the outcomes of the statistics related to birth centers, but we had limited options in New York City, and we continue to do so. We need to change this. Simply that, we need to change this. Can I get a "we deserve birth centers"?
We deserve birth centers.
We deserve birth centers.
We deserve birth centers.
That's right. And so, next up, I would love to introduce Jessica Gonzalez Rojas, who is also a champion and supportive of this cause. And I welcome her to continue to be a champion and tell her story.
Thank you so much. I'm so enamored to be here because prior to running for elected office, I spent 13 years as the executive director of the National Institute for Reproductive Justice. And maternal justice and birth justice is centered in that fight. And I'm proud to bring greetings on behalf of the task force on women's issues, because this is an issue that impacts not just women, but families. And as you mentioned, Bruce, who's been a champion on this issue, has personally dealt with the impacts of poor maternal health outcomes. As others have said, this is disproportionately impacted communities of color and women of color. Black women are 4 times more likely to suffer adverse consequences and even death during birth. I represent Queens, where nearly 29% of folks who have low-risk pregnancies end up with a C-section. Nearly 8% of women in Queens are not able to access prenatal care. Prenatal care is vital for every single healthy pregnancy. So this suite of bills is the right thing to do. I personally had my child with a doula and a midwife at my side. I was hoping to use a birth center, one that's no longer there. And I ended up in an emergency C-section after 48 hours of labor. But I had my midwife and I had my doula. So despite the fact that the birth wasn't the birth I wanted, it was the birth that was given. And my midwife said there's no such thing as a second-class birth. And this package of bills will ensure dignity, health, and justice for every single birthing person in New York, and we must get it done. Thank you so much.
So next up, we have an organization push for empowered pregnancy. Samantha Battery, who's representing Push. And I believe stand by or come up. Samantha Battery, Cassidy Perone, the stillbirth bill is essential for being uplifted right now. We're trying to elevate everything that has to do with maternal and infant health. Mariah from the Better Balance has been instrumental in the postpartum maternal leave act and the TDI. We're going to talk about all of that. And Samantha, would you like to begin? I'm not sure you're taking the mic.
Thank you so much to the Mobilize Maternal Health Coalition. This group has been so incredibly supportive of our mission to end chronic silver. My name is Samantha Battery. I'm the Executive Director of Push for Empowered Pregnancy. We are a 501c3 a normal and healthy pregnancy. Unfortunately, my story is not unique. There are up to 4 stillbirths every single day in New York State and 65 across the country. Stillbirth is, according to CDC data, claiming 4th American children's lives up to age 14 than prematurity, SIDS, car accident, drowning, guns, fire, poison, flu, and listeria combined. And yet, it has never been a priority in our medical system to prevent this. One thing that many people don't realize about stillbirth, which is medically defined as the death of a baby in utero after 20 weeks of pregnancy before that miscarriage, is that stillborn babies must still be born, just like any other baby. So whether that's a vaginal delivery, a C-section, these are moms who are going through the exact same postpartum experience as any other mother. And unfortunately, often becomes an invisible postpartum experience. And stillbirth, another thing people don't realize is that stillbirth is intimately related to the maternal mortality and morbidity crisis in this country. Just like maternal mortality, Black mothers are at more than twice the risk of suffering a stillbirth. This is due not only to social drivers, health, and access to care, but also systemic structural racism. Because as we see with maternal mortality and morbidity, even Black moms in particular, who are privileged, educated, wealthy, doing all the right things, are suffering stillbirths at more than twice the rate of their peers. Further underscoring this is the fact that moms who had a stillbirth have been shown to be almost 5 times as likely to suffer severe, mentally life-threatening maternal complications. And as the previous speakers have shared, these most frequently happen in the postpartum period. In New York State, 60% of maternal deaths happen in the postpartum period, and 2/3 of those are in the first 6 weeks after birth. And what's really not helping these statistics is the fact that for those up to 4 stillbirth moms in New York every day, those who qualify for paid family leave are coming back, as my friend Cassidy, who cannot be here today, she's from Chicago, as my friend Cassidy found after her daughter Olivia was born still. She came home from her daughter's funeral, and the next day received a call from New York State telling her that her previously approved paid family leave, which she had been paying into for years as an employee and approved for $1,100 per week after she gave birth, was being revoked. Because callously, New York made sure to point out to her that she no longer had a baby to bond with, and therefore did not fall under the provisions of paid family leave anymore. However, they reassured her, don't worry, because you still qualify for temporary disability insurance at a whopping $170 per week. As the primary breadwinner in her family, Cassidy had to make the same difficult choice that so many New York mothers had to make. In fact, over 2,000 of them since Cassidy brought this issue to the legislature's attention in 2022 to choose between her physical and financial health. Her doctor would not approve her to go back to work because you can't approve anyone to go back to work within 6 weeks of giving birth. And so Cassidy made the difficult choice to go into debt, run all her credit cards in order to continue paying for family bills and keep herself safe. How many families in New York don't have that option? And so that is why Cassidy has brought this issue to the legislature, and we've been fighting for 3 years now to get it finished. And so I'm very, very pleased to have here our colleagues from Mobilize and several amazing legislators who have been our champions in this battle to help get this issue fixed. Currently through Bill A84, which is to close the gap in PFL, while also bringing temporary disability up to livable wages for the first time in 30 years. So I would like to turn it over to to our legislative. Okay.
Thank you so much, everybody, for being here, and thank you so much to the Mobilize Maternal Health Coalition for all the wonderful work that they're doing. My name is Mariah Anker, and I'm an organizer with A Better Balance. A Better Balance is a national legal services and advocacy organization headquartered in New York, which uses the power of the law to advance justice for workers so they can care for themselves and their loved ones without jeopardizing their economic security. We run a free and confidential legal helpline through which we hear from thousands of workers a year, including hundreds of New Yorkers who need paid family and medical leave. At A Better Balance, we firmly believe that no worker should be forced to sacrifice their health for a paycheck. Paid medical leave is important for countless workers in New York who need to take time off of work to address their own serious health needs, including complicated pregnancies, and it is also something that is deeply personal to me. In 2023, my partner had a medical crisis and he delayed care because he was afraid he was going to lose his job for seeking treatment. He delayed treatment until he had no other choice but to be hospitalized. While he was in the hospital, I had to tell him that his job was not protected, that he could lose his health insurance, and that he would only be getting $170 a week. Unfortunately, too many New Yorkers have had to tell their loved ones that their worst fears about taking time off to care for themselves were true. Under our current paid medical leave program, known as temporary disability insurance, which we also mentioned, too many New Yorkers have had to tell their loved ones that yes, you read that right, the wage replacement cap is $170 a week. And no, your job is not protected, and neither is your health insurance. Last year, we were close to reforming TDI. I was hoping that 2024 would be the final year workers would have to hear that they could be fired, they could lose their health insurance, and that they better have enough savings to cover lost wages during their hospital stay. Does a loved one need to go back to work on a limited schedule, or need to take a day off here and there for treatment? Currently, our paid medical leave program won't let you do that. Nothing has changed since 2023, when I was in the position of telling a loved one that his worst fears for taking time off of work to care for himself were true. What's more is that nothing has changed since 1989. Workers have been stuck at $170 a week with no job protection, no health insurance, and no ability to take leave intermittently for 36 years. $170 may have been enough in 1989, but it certainly wasn't enough for my loved one in 2023, and it isn't even close to enough today. Compared to the 14 other states, including DC, with paid medical leave programs, including our neighboring New Jersey, Connecticut, Massachusetts, New York lags far behind. Had my partner worked 8 miles away in New Jersey, he would have been able to access job-protected medical leave and over $10,000 a week. That is more than 6 times the wage replacement rate available in New York workers. That is unacceptable. All of us may need paid medical leave at some point in our working lives. During some of the most stressful periods of your life, a new diagnosis, a surgery, a complicated pregnancy, or pregnancy loss, the last thing you should be worried about is whether or not your job will be there for you when you get back, or if you can afford to put food on the table. Through ADD's helpline, we've heard from workers who faced eviction for making impossible choices between taking care of themselves and their loved ones, and putting food on the table. The legislature must include AA4 S172 in their final budget. In the state of New York, workers should be able to focus on their health. In her State of the State announcement, Governor Hochul said, "Your family is my fight," assuring New Yorkers that her priority is more money in workers' pockets. A Better Balance couldn't agree more. No New Yorker should ever have to sacrifice their health for a paycheck. Despite the governor's promise, without comprehensive reform to the TDI law, workers who need to take paid leave for their own health are left without a safety net. Our lawmakers can fix this by passing AA4 S172 in the final budget. Over 100,000 New Yorkers will be diagnosed with cancer this year. Countless others will need to take time off of work to manage chronic conditions like MS, long COVID, mental illness, substance use disorder, complicated pregnancies, or any other illness or disorder that would require you to take time off of work. AA4 S172 will allow these workers to take the time they need to address their health conditions without risking their economic security. This bill will also allow trans and non-binary working New Yorkers to access the life-sustaining care they need without fear of losing their job, their health insurance, or their apartments. New York has an unacceptable black maternal health crisis, Sufficiently paid job protected leave with the guaranteed health insurance and intermittent leave will provide a lifeline for business. We can't wait another year. Thank you.
There are so many grassroots individuals, people here on the ground, but we cannot move things forward without our legislators' support. So I want to acknowledge some of the electeds that cannot be present and some who are going to take the floor momentarily. Mikhail Solajas has been amazing in supporting everything that Mariah just spoke about. And present today are Assembly Member Pfeffer Amano and Senator Shelley Mayer. Please take the floor. Thank you. Thank you so much. You know, several years ago, Samantha Banerjee and a number of other women who had experienced stillbirth came to see me. And they told the story Samantha told of someone who experienced a stillbirth and literally had their paid family leave revoked by the state of New York. That is unacceptable. And we've had a bill several years, previously carried by now Congressman Tim Kennedy, to fix that. In addition, we've had legislation that we continue to carry together to fix the temporary disability insurance system to reflect the actual costs of being out of work due to a non-work related disability. That's what TDI is about. And yet that doesn't fix any of these problems either. We've heard from a variety of speakers talking about the experience of women experiencing childbirth. And that is a complicated but intertwined story that is simply not getting the attention of our state at the direction that it needs. We need research into stillbirth. We need money for paid family leave. We need TDI to fix. We need attention to the disproportionate impact of maternal mortality on women of color. We are simply missing the boat. And it is time to fix the boat, fix these bills, get these bills passed, and finally pull these things together and recognize that women are not going to stand by idly while our lives, our children, our families are at risk. It's time to fix this. Good morning, my name is Stacey Pfeffer Amano. I'm an assemblywoman that represents the 23rd District, the southern part of New York City. What we're talking about here, first of all, let me just give thank you to all of you standing here today for your advocacy, sharing the most personal stories and trauma that you and your families have gone through. We have to get to this level to move the ship, as you're saying, as it's sailing, but we have to be open in this space. So I want to say to you that these laws and dollar amounts are so archaic, I'm done with it. And what we're saying to you, and I'm going to bring this back to stillbirth, is that a woman who has a stillbirth on Monday is expected to go back to work on Wednesday. That is completely unacceptable. We stand here today to fight for that. It's common sense. It's not okay. The laws must be fixed. They're archaic, they're outdated. We're standing here strong with our few males. Thank you very much for being here. But as women, you know, the fantasy is that the stork delivers the baby, that we're watching soap operas, how people give birth with full makeup on. That's not the experience. It's an experience that we all treasure, and we want to have a perfect birth. But there's no perfect. There's everyone's experience. And we have to make whatever that outcome is, has to be supported in New York State. Women must be supported in New York State for whatever their birthing experience is. Again, we're talking about mortality rate. I'm going to tell you my experience for a second. I'm a mother of two and had two severe postpartum experience afterwards. I had a full line of people lined up to take care of me, and it still was not enough. To the point that I said that I want to put my daughter up for adoption. We're talking about very deep depression that happened, and I had 2 live births. So let's talk about the experience that doesn't come out that positive outcome, and how we leave women on the side, and we leave the fathers, the family, the partners, whoever it is. Unacceptable in New York State. We're not leaving anybody on the sideline. We want New York to stand up for our birthing experiences. Thank you.
We just have a couple more speakers.
working every day, part of the partnership of Mobilize Maternal Health Coalition. And as you know, we are uplifting the causes that matter and are relevant for maternal health. I'm going to shift into the concept of how, in addition to midwifery, we want birth centers. Is that right? Yeah. And so, in order to be birth centers, yes, we need midwifery. And we need to. And so next up, we have Kim Holden, who is going to speak on one of the many stories of birth centers that are in progress here in our state that have not had fair access to licensure, and meanwhile support so many families in a rural area that deserve this type of care. Okay, and next up, I'll ask Albany, who is working over the birth center in Queens, and so we also want to relate to midwifery care.
Thank you, Myla. Thank you, everyone who's spoken here today. This is such an important issue. My name is Kim Holden. I'm an architect. I'm a doula. I'm a certified lactation counselor, and my work is focused on the impact of intersection birth, environment, and the impact that midwifery has on outcomes, trauma, racial disparities, and maternal mortality. I'm here to read an excerpt from a testimonial of Laura Winkler, certified nurse midwife, and the founder of the White House in Buffalo, New York. I am a certified nurse midwife who applied for birth center accreditation with the Commission for Accreditation of Birth Centers and licensure with the Department of Health in 2020. Despite being accredited by CACC in 2021 and reaccredited in 2024, I've been unable to obtain licensure from the DOH. My birth center, the White House in Buffalo, New York, is the only option for out-of-hospital birth in my community and serves clients on a 2-3-hour radius. Achieving accreditation twice, yet being denied licensure, indicates a malfunctioning licensure process in New York State. The DOH is probably maligned by birth center and provides safety and quality concerns that don't exist, given they've achieved and maintained the gold standard of accreditation. Denying licensure in the name of safety is illogical. If the DOH prioritized licensure, they would regulate birth centers and create safer living spaces. The White House serves a diverse population, with 40% identifying as BIPOC and 70% as Medicaid managed care recipients. By denying licensure, the DOH has diverted resources away from a community needing high quality and free care and deprived the person of facility fee reimbursement, rent, and sustainability. On a quick personal note, both of my person was a midwife and a doula at the birth center in New York City, and my experience has been completely different. I have had support. That birth center is new closed. And when I'm this is not only a legislative, it's a society issue. It's I want to reinforce that. Thank you so much.
Good morning. Thank you so much for having me here. And I'm proud member of the Mobilize Maternal Health Coalition. I stand here to represent Birth by Queens, which is going to be the first birth center in Queens. In 2019, I was thinking exactly what we're talking about today. Access to midwifery care, access to doulas. I had a doula. The doula came to me from the hospital, and guess what? They refused her at my birth. So I ended up in an emergency C-section, but I'm thankful for my blessing for standing here with me today, because she is my strongest advocate. We need access to more. In Queens, we have 2.2 million people, but we still don't have access to CPS. We still don't have universal access to doulas, midwives, birth centers, all of the things that I know our families need. I saw firsthand what was needed. My daughter was born right before COVID-19, before the city shut down. So imagine the impact. The little bit of resources we did have was taking away. So I was proud to become a postpartum doula, followed by a birth doula, and then I became an IPCLC, which is an international board certified lactation consultant. Our families do not have access to breastfeeding support prenatally and postpartum. And we know that the
Black Mamas Matter! Black Mamas Matter! Black Mamas Matter! Black Mamas Matter!
That's right. So now, as we close, I want to first recognize and put on my hat of the New York State Birth Center Association president for just a moment and recognize that while we are here today uplifting CPM licensure, TDI, the stillbirth bill, we also recognize that the New York State Birth Center bill, midwifery birth center bill that passed is not serving us in the way that it was passed. And so the legislative direction that we will work towards is to eliminate barriers to licensure for midwife birth centers. That fight continues, and we will be back. And we're grateful for all the support, trust, and partnership of all the individuals here today. Your presence acknowledges the importance of the work. We are not just acknowledging 1 or 2 or 3 bills. We're building a movement. We're learning about those bills. To our team, our volunteers, our community leaders, thank you for unwavering dedication and commitment to maternal health. And to every individual who's walking alongside us who will join this walk, thank you. Power to mobilize! 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 Thank you. Yes. Thank you. So glad you made it. Share comments. Even if you watch the post, comments.
Hope y'all enjoy. Be sure to share with everyone you can and make sure to keep this up in the conversations you're having with everybody.
Catch the playbacks for the TDI, catch the playbacks for CPMs. You're going to learn so much. There's more teach-ins coming soon.
Yes, lots more, and there's going to be a new call to action. Once we get home from Albany today, we'll update you guys on the current status of all the bills and let you know what you can do to make sure they get over the finish line. Thank you so much. United we push.